The Southern African nation has declared a public health emergency after hospitals ran out of essential medicine.
On national television, the gravity in his voice told Botswana this was not just another government briefing. It was a turning point. President Duma Boko stood before the nation and declared, "The work shall remain non-stop until the entire value chain of procurement has been fixed." The words carried weight. For a country long accustomed to calm, predictable governance, this was a moment of rupture. Botswana was officially in a state of public health emergency. And the details he laid out were shocking. Essential medicines for cancer patients had vanished. Antiretroviral drugs for HIV treatment were almost gone. Supplies for tuberculosis patients had run out. Hospital shelves were bare. The health ministry revealed that debts to private facilities had crossed 1 billion pula. Elective surgeries, organ transplants, and non-urgent medical referrals were suspended indefinitely, and remote villages like Dakar, UNICEF teams warned of growing malnutrition, especially among children. Botswana's health crisis was not confined to hospitals. It was now threatening the survival of its most vulnerable citizens. The government's response was immediate and militarized. 250 million pula was released from emergency reserves. Plans for a much larger 5 billion pula rescue package began to take shape. Army trucks, usually seen in ceremonial parades, were now loaded with emergency supplies and dispatched overnight across the country. The sight of military convoys rolling through Botswana was a stark symbol of just how deep the crisis had sunk. Gaborone's Princess Marina Hospital, patients waited for hours, sometimes only to be told their medicines might never arrive. Nurses and doctors, praised for their resilience, improvised treatments with whatever stock remained. Families were told, "Buy medicines privately if you can." But for most, in a country with high unemployment, that was impossible. This crisis, however, was not simply about empty warehouses or late deliveries. It was about something deeper, the fragility of a system many believed was stable. For decades, Botswana was praised as Africa's miracle. Its diamond revenues built roads, schools, and a reputation for stability. It was hailed as one of the continent's success stories. But now the contradiction was plain. How could a country globally celebrated for wealth and good governance suddenly fail to provide medicines to its own people? The answer lies in the very diamonds that built Botswana's prosperity. Diamonds. Wealth without security. Botswana produces nearly 1/5 of the world's diamonds by value. For decades, diamonds have been the crown jewel of its economy. But here's the catch. The wealth they generate does not stay in Botswana. From the moment they are mined, Botswana's diamonds are shipped abroad, into a global trade chain dominated by international corporations and foreign markets. The heart of this system is De Beers, the diamond giant that once held near total control over Botswana's diamond sales. Even today, after renegotiated contracts, most of the value is still captured abroad. Diamonds leave Botswana in rough form. By the time they are polished and sold in Paris, London, or New York, their value multiplies many times over. But those profits rarely return to Gaborone. This is Botswana's paradox. On paper, the nation is rich. In GDP reports, the numbers look impressive. But in practice, when it comes to something as basic as a health budget, the funds are shockingly limited. And when global demand for diamonds declines, as it has in recent years with slumps in the US and China, Botswana's revenues plunge. The government still depends on diamonds for 2/3 of its export earnings and more than 1/3 of its budget. When diamonds sneeze, the entire nation catches a cold. The health crisis exposed this dependency brutally. Without steady revenues, hospitals could not stock supplies. When external shocks arrived, the system collapsed. It is the same colonial model Africa has known for centuries. Export raw wealth, import expensive finished goods, and remain vulnerable. Diamonds may glitter abroad, but in Botswana's hospitals they did not buy medicine. The hidden dependency. Foreign aid. But diamonds are only half the story. The other half lies in foreign aid. For decades, Botswana's health system, especially its world-renowned HIV response, was heavily supported by foreign donors. By 2020, nearly 1/3 of Botswana's HIV funding came from the United States, and a country where almost 1 in 5 adults lives with HIV. That funding was not optional. It was survival. On the surface, the partnership was hailed as a model of cooperation. Western governments pointed to Botswana as proof that aid could transform lives. But aid is never free. It creates reliance. It shifts decision-making power away from local governments. In Botswana's case, health budgets were tied not to Gaborone but to Washington. And then came Donald Trump. During his presidency, Trump slashed U.S. aid budgets, cutting HIV funding to countries across Africa, including Botswana. Almost overnight, the country lost a significant share of its health resources. For Washington, it was a matter of fiscal policy, but for Botswana it meant lives at risk. Hospitals had to divert scarce domestic funds to HIV care, leaving other areas, cancer treatment, tuberculosis programs, surgical services, starved of resources. One decision in a foreign capital created ripple effects across an entire health system thousands of miles away. This is the danger of aid dependency. It looks like generosity until it disappears. And when it disappears, the fragility beneath is exposed. Botswana's health system was not as strong as it looked. It was built on donor scaffolding. When the scaffolding was removed, the cracks showed immediately. Duma Boko's gamble. For President Duma Boko, the health emergency was not just a medical crisis. It was the ultimate test of his leadership. He came to power in late 2024, breaking 58 years of uninterrupted rule by the Botswana Democratic Party. A Harvard-trained lawyer with Pan-African leanings, Boko had promised to diversify the economy and end Botswana's over-reliance on diamonds. Now, less than a year later, he was faced with the hardest test. Could he lead Botswana through its most severe crisis without falling back into dependency? His decision was bold. Instead of rushing to foreign donors for emergency relief, he tapped into domestic reserves, 250 million pula for health procurement, and mobilized the Botswana Defense Force to manage supply distribution. This was more than just logistics. It was symbolism. Boko was sending a message. Botswana will solve its problems with its own hands, not with foreign lifelines. On a continent where many leaders turn first to the IMF, the World Bank, or foreign donors in times of crisis, this stance was revolutionary. But it was also risky. Botswana's reserves are not limitless. The economy is still tied to diamonds. If the emergency plan fails, critics will accuse Boko of recklessness. Yet if it succeeds, he could set a new model for African governance. One where sovereignty is not just a slogan but a strategy. Rebuilding the system. What makes Boko's approach unique is his focus on systems, not patches. In his national address, he did not only promise to restock hospitals. He promised to rebuild the entire procurement chain, from sourcing medicines to transporting them, to ensuring hospitals are never empty again. This means cutting out corrupt middlemen, investing in local pharmaceutical capacity, and making Botswana less dependent on imports. Imagine a future where Botswana's diamonds don't just leave the ground to enrich foreign markets, but instead fund domestic pharmaceutical factories, where the nation produces its own medicines, securing health sovereignty. This is the vision Boko hinted at, not just short-term fixes, but a transformation of how Botswana manages its wealth and serves its people. The continental context. But Botswana's crisis is not unique. Across Africa, similar struggles are unfolding. In Niger, the military government seized control of uranium mines long exploited by France, declaring that Niger's resources would no longer power Paris while Nigerians lived in darkness. In Burkina Faso, President Ibrahim Traoré launched a state-owned gold refinery capable of processing 400 kilograms a day, ensuring that the nation's gold wealth finally benefits its own citizens. In Angola, contracts in the oil sector are being rewritten to give Luanda greater control over its resources. Each of these moves signals the same shift. Africa will no longer be a supplier of raw materials while its people suffered. Botswana's health emergency is part of this broader story. Its medicine shortages are not just logistical failures, they are symptoms of the same structure that keeps Africa dependent. A structure where Africa exports its wealth but imports its survival. Africa's awakening, as military trucks rolled out of Gaborone, carrying medicines to remote villages, they carried more than supplies. They carried symbolism. They symbolized Botswana's choice to act, not plead, to rely on its own resources, not foreign donors, to confront dependency even in the midst of crisis. History shows that sovereignty rarely comes in times of comfort. It emerges through necessity, through struggle. Botswana's crisis, painful as it is, could become a turning point, forcing the country to reimagine its future. A future where diamonds fund health, where aid dependency is replaced by domestic strength, and where sovereignty is built not on slogans but on systems. And this is why Botswana's declaration matters far beyond its borders. It is part of Africa's wider awakening. From Niger to Burkina Faso, from Angola to Botswana, Nations are rising with the same demand. Africa's wealth must finally serve Africans. The question is no longer whether Africa is rich, it always has been. The question is whether that wealth will finally be used to build sovereignty, resilience, and prosperity at home. Botswana has just answered with a resounding yes, so we ask you, should Africa continue to rely on foreign aid while controlling the world's most valuable resources? Or is this crisis the beginning of a new era of sovereignty? Let us know your thoughts in the comments. And if you want to see more videos exploring Africa's history, struggles, and awakening, subscribe to the channel and stay tuned. Because what is unfolding in Botswana may one day be remembered not as a tragedy, but as the spark of Africa's rebirth.